I hope that we are utilised for the skills and the abilities that we all have, and that we are a trusted and valued member of the healthcare team, and that we can use our skills to our full scope of practice.
So the most important thing for mental health nurses around Australia is legislative change. What we need is endorsement of credentialed mental health nurses on the registered nurse register.
Health policy settings also change to enable those highly skilled, qualified health professionals that are nurses and midwives to be able to work to their full scope of practice.
I hope in the future that nurses will be able to work to their full scope of practice and be confident enough to ask the question of everybody that they see around their substance use, because as we know, as drug and alcohol nurses, that it touches every part of the community, rich, poor and all in between.
I think for nurses the change has to be being backed in by governments of all types and persuasions to make sure that they reach their full potential, because if they do reach their full potential, their full scope of practice, they're going to do amazing things for Australians and show the world how good Australia's healthcare system is.
I just really hope that nurses are able to be fully optimising their scope of practice. I also wish that they actually understood how they are responsible for determining their scope of practice. Knowledgeable, skilled, confident and competent.
One thing I'd like to change would to see nurses be able to make clinical decisions and act on those decisions in an autonomous way.
The key thing that I think needs to change for nursing is the recognition of the types and forms of care that nurses can provide the Australian public, and in particular that politicians and media recognise the important contribution that nurses make to the health system, noting that nurses make up 54% of the health profession.